What we've learned over the course of the last probably about 20 years is that some of the cancers that start in the ovary, or that we thought started in the ovary, on the outside, actually perhaps start in the fallopian tube. And these are the high-grade serous ovarian cancers. And these are actually the most common and most aggressive ovarian cancers that we treat and that are diagnosed. Unfortunately, we do not have an early screening test or early detection test for ovarian cancer. So unlike breast cancer or cervical cancer, where we actually have a screening test, which is designed to pick up a cancer early in somebody who doesn't have any symptoms, no such test exists for ovarian cancer. So most of the time when someone is diagnosed with an ovarian cancer, it's based on imaging and or other tests, like a blood test like CA-125, combined with findings on imaging that show that the person has something going on from a growth standpoint. So the fallopian tube biobank is actually one in which we are harvesting some of the cells from inside those fallopian tubes. These fallopian tubes are presumed to be benign or normal. We are harvesting some of the cells and keeping them alive such that we can actually grow small versions of the fallopian tube called organoids. This research is really important because we now understand that some people who are at higher risk for ovarian cancer because of a genetic predisposition, that their cancer actually starts in the fallopian tubes. The important thing about Li-Fraumeni syndrome is that it increases the risk of several different cancers in an individual. And by the age of about 30, that risk of developing a cancer in the spectrum of Li-Fraumeni is roughly about 50%. So it's pretty high at a young age. We also know that high-grade serous ovarian cancers or fallopian tube cancers, that about 95% of them have a p53 mutation. So in a person who has both a gene that puts them at risk for ovarian or fallopian tube cancer and carries with them in all of their cells a TP53 or a p53 gene mutation, this is a really great opportunity to better understand how some of these cancers might actually start.